Okay, so we're going to get straight to the exercises. So this short routine, if you can do it 3 times a day, that's brilliant, because we're going to start gently bringing that mobility and rotation back to the shoulder area, in particular an injured shoulder area. Now, as with all of the exercises, and I'm doing this sitting down, you can also do these standing up, but if I show you sitting down, then you can look at what's going to be best for you as an individual and your mobility and your capability. So what we're going to do first is we brace the shoulders back. So most of us are very forward rounding with the shoulders, so we drop the shoulders back, relax the chin and the neck, and try to keep the shoulders level. And all we're going to do first of all is just bring in a little bit of gentle mobility. So taking the head round to the right hand side and then coming back to centre. And again to the other side, not holding for too long because we're using this for mobility, coming back to centre, and then we're going to bring the ear to the shoulder, come back to centre, and then repeat on the other side. And relax the head down. We're going to take the head slightly over to one side, and we're going to just drop the chin towards the chest at that angle, and you'll feel that increased stretch going in to the neck and the shoulder area. And you'll notice that you always bring your head back to centre. And let's repeat that on the other side. So just gentle stretch, holding it in place, and then come back to centre. Just have a little relax and shake down of the arms. So what we've done is we've engaged the head and the neck muscles. Then I want you to just practice a little bit of elevation of the shoulder and relax down. And again on the other side, and relax down, and then both together, bringing the shoulders up and relax down. If you're sitting doing these exercises like I am, really pull in the abdominals, lift up and keep that back as straight as you can. And then we're going to start by gently just opening up the shoulder, and always take the shoulder back. We're going to just go for 4 reps on each side. Now if there is a particular shoulder that you have injured, what you want to do is to make sure that you balance. So for example, if you are only to do the one shoulder, the other shoulder, which will be overcompensating because it will be doing most of the work than the shoulder that's injured. So always repeat that on both sides. Now depending on your range of movement, we're going to see if we can just start to open up those muscles that attach to the shoulders. So the elbow is going to be in, and you're going to take the arm out, and you're going to hold it and take it to a place that's comfortable. If you feel any discomfort, then you just don't take it to the extra point, you just take it to where it feels comfortable, and then you come back, and then you bring the other arm in and you repeat on the other side. So you're opening up across the chest, you're opening up the arms, and then you come back, and then if you can, just both together. So all we're doing is we're just starting to engage the shoulder into the different areas of movement. So then what I want you to do is you're going to lean forward slightly. I'll turn round. You're going to drop the arm down, and you're going to literally just circle that shoulder. So if I stand up so you can see. So what I'm doing is I'm just, and if you stand up, just bend the leg slightly and just let the weight of that arm. So this is really opening up, but using gravity to help. You can do that sitting down or standing up. So you're loosening up that shoulder area. So those first few exercises are just going to warm up the shoulder and start to engage some of those muscles. Now also think about your mobility and whether or not you're able to take it to certain limits. If you practice this, say 4 of each on each side 3 times a day, then they will start to have the effect of warming up the joint and increasing that mobility. Now if you place your hand on your shoulder, the opposite hand on the opposite shoulder, what you're going to do is you're going to slowly lift the arm up and then you're going to come back down. So again, we're doing supported elevation, coming up and then down. You can always use the other hand to support if the arm feels quite heavy, and relax down. So taking that support and bring the arm down, relax the arm. So what we're using, we're going to repeat that on the other side, the different movements that the arm, from lateral rotation, we've done a little bit of internal rotation and we'll look at the difference in that. We're also doing a little bit of gentle extension work and some flexion work. All you need to know is just to follow the actual pace of where we're doing the exercises to, and then release down. So external rotation, so when you're doing like we did with the arm circumduction, you're supporting the shoulder and you're externally rotating it out. And you can bring in a little bit of internal rotation, but in general we like to take it back because we tend to be quite forward within our range of movement anyway. So they're the simple ones that I want you to start, just to start to engage those muscles. It's gentle, it's very precise, and it just starts to bring the shoulder back to a range of movement. Okay, and what we can do is, when you've done that for a little while, we can then go on to the next stage of exercise, which is assisted arm walking up to the wall, or you can use your hand underneath. But for now, let's just get that shoulder, oh, I can feel that click, moving. Okay.